gracious you are.
Yeah, so first of all, I would like to welcome you all for the session. And Shiva ma'am, a warm welcome for you. And I'm handing over to Anisha ma'am to introduce your faculty. Ma'am, over to you.
Good afternoon, ma'am. This is Anusha. I'm the facilitator for today's session. Today our topic is lymphedema. Our speaker, Miss Shiba ma'am. So she is a section head and education and skill building, Trivandrum Institute of Palliative Sciences at Palliative, India. She had experience in palliative care since 21 years, and she has a national faculty for IAPC and faculty for National Health System Resource Center, featured as a pioneering nurse from around the world by St. Christopher's Hospice, UK in 2020. Welcome, ma'am. Welcome for this session.
Thank you. Very good afternoon to all of you. Happy to see you all. As said earlier, today we are going to learn about lymphedema management. So you have learned a few other nursing issues past. This is also one of the nursing issues in palliative care. Hope my voice is clear to everyone.
Yes, ma'am, you can continue.
Okay. So let me share my screen. Okay. Hope my screen is also visible to everyone. So lymphedema is related to lymphatic system. We all know that, right? So throughout our lymphatic system, lymphatic fluid is flowing. So let's see what is lymph. So we all know that lymphatic system is one of the most important part of that function will be taken care of. So it's very, very, very important. We have to learn. Before moving on to the lymphedema part, I would like to that go through the anatomy and physiology, few things, and so that you can understand well about the lymphedema. Okay. So throughout our lymphatic system, as I already mentioned, the lymphatic fluid is flowing. So what is lymph? Lymph is a tissue fluid or an interstitial fluid is collected through the lymphatic capillaries, then enters into the lymphatic vessels to lymph nodes. It contains protein, lipids, and water. So this is called lymph. So this fluid is flowing throughout our lymphatic system. Let's see the major functions of lymphatic system. There are three major functions of lymphatic system. One is reabsorb excess interstitial fluid. Second one is transport dietary lipids. And the third one is lymphocyte development and the immune response. Because the first one reabsorb excess interstitial fluid. So wherever the arterial capillaries and the venous capillaries are communicating together, there will be a that collection of lymphatic fluid, that there is a leaking out of substance into the interstitial tissue space called lymph. So that fluid is absorbed with the help of a lymphatic capillary, so that our fluid and electrolyte balance are well maintained. And the second one is transport dietary lipids. In our small intestine, there is a special type of village called lactase that will be picking up of that lymphatic fluid and also that transportation of dietary lipids into that small intestine. So that is two role that that part is that handy. So that the two major part that function will take care of that part. And the third important function is lymphocyte development and the immune response. So we know, so we need a lymphocytes. So they are the important part for protecting us from the infection. So if there is no lymphocytes in our body, so we will get that infections very easily. For example, if for just imagine a patient diagnosed with a carcinoma breast. So the immediate treatment is surgery, right? So when we do surgery, we will remove the breast and also adjacent lymph nodes also. That there is a adjacent lymph nodes also. The axillary dissection is also done. at the time of surgery, right? So why we are removing the that lymph node? So we are protecting the patient from spreading the disease from one area to the another area. So we are trying to prevent metastasis. So here, that patients can develop edema because there is no lymphocytes, lymph node is there for fight against bacteria. That area is prone to develop infection. So this is one of the most important part of the function of lymphatic system. And if there is any problem developing in that particular area, so that that area is prone to develop infection. Okay. So this is our systemic circulation. We all know that how this systemic circulation is happened, right? So why I am highlighting this picture here is, if you look into the upper part and the lower part, and also so when we look into the lungs, so there will be a connection between the arterial capillaries and the venous capillaries, right? So there will be a connection between the arterial capillaries and the venous capillaries. So in the upper part and the lower part is same. So wherever the arterial capillaries and the venous capillaries are communicating together, so there is a chance of leaking out of fluid from the leaking out of fluid from when the arterial capillaries are communicating together, it will happen. So that fluid is leaking out into the interstitial space. So here, we know in our upper part of the body, so our superior vena cava collecting the deoxygenated blood from the upper part of the body, and it goes to the right atrium. And the lower part of the body, inferior vena cava, collecting the deoxygenated blood, and finally it enters into the right atrium. From right atrium, it goes to right ventricle. Then, with the help of pulmonary artery, it goes to that blood, deoxygenated blood is go to the lungs for purification of blood, right? So again, there also there is a communication between the arterial capillaries and the venous capillaries. So why I'm highlighting this picture here is, wherever the arterial capillaries and the venous capillaries are communicating together, so there is a leaking out of substance, that fluid-like substance, that is called lymph. So that fluid is absorbed with the help of a lymphatic capillaries. Okay. So this is our arterial system, this is our venous system. So as I mentioned earlier, there is a connection between the arterial capillaries and the venous capillaries. So when the arterial capillaries and the venous capillaries are communicating together, you can see this picture, that green color. So that green color is a lymphatic capillaries. Okay. So there is a chance of leaking out of fluid, like substance, into the interstitial tissue space. That fluid is absorbed with the help of a lymphatic capillaries. Then from there, it goes to through the lymphatic vessels, it enters into the lymph nodes. Okay, I'm coming to that part later. So this is how our lymphatic system works. Okay. So coming to the lymphatic capillaries, the structure is, it was blind end, and also single layer of overlapping endothelial cells. You can see this picture, it is overlapping. So wherever the fluid is originated, the lymphatic capillaries will be absorbing the fluid from the that interstitial tissue space. So the third thing is more permeable than that of blood capillary. So that little big molecule can also the molecule also can be absorbed with from the lymphatic capillary. So that fluid might be contain virus, that bacteria and waste products, but wherever the fluid is original, that lymphatic capillaries will be absorbing the fluid. Coming to the small intestine, in our small intestine contains special type of lymphocytes, lymphatic capillaries called lactees. So these two functions are carried out there. So one is picking out of interstitial that fluid, and the another one is transportation of lipid soluble vitamins. Okay. Coming to the lymph nodes, so this is one of the major part of our lymphatic system. So from the lymphatic capillaries, through the then it goes through the lymphatic vessels. Then that fluid is entered into the lymph nodes. So it is located. It's around 600 to 700 lymph nodes in our body. So it is located in between the lymphatic system. So that fluid, that lymphatic fluids is entered into the lymph nodes for filtering out of harmful substance. Okay, so it is typically found in clusters, and the major function is receive lymph from many body regions. So and the next thing is, after that receiving the lymphatic fluid from the body regions, the lymph nodes will filter out the harmful substance from the lymphatic fluids, and the clear fluid is drained in our circulatory system, and the waste product is flushed out from the body. So these are some lymphatic organs: tonsils, thymus, spleen, lymph. These will help us to protect that, fight against bacteria, that infection, or protect from infection. So there are two major lymphatic duct, right lymphatic duct and the thoracic duct. So you can see this picture. So this much area is drained through the right lymphatic duct, and the other major part is drained through the thoracic duct. So I already mentioned these things. Wherever the arterial capillaries and the venous capillaries are communicating together, there is a chance of leaking out of fluid-like substance into the interstitial tissue spaces. That is called lymphatic fluid. That fluid is absorbed with the help of a lymphatic capillaries. So this is a flow chart. So the lymphatic capillaries are absorbing fluid from the the interstitial tissue spaces, and then it goes to lymphatic vessels. Through the lymphatic vessels, it enters into the lymph node, and then again it enters into the another lymphatic vessels, and through the lymphatic vessels, again it enters into the lymph nodes. Finally, through the collecting duct, it enters into the subclavian vein. Okay, so subclavian vein is a part of the circulatory system. So finally, this end will be in the subclavian vein. So that is why we usually call the lymphatic system is a part of the circulatory system. So the lymphatic system circulate protein-rich lymphatic fluid throughout the body. We all know that. So it might be contains bacteria, virus, and the waste products. And then the major function of lymph node is to filter out the harmful substance from the lymphatic fluid. Okay, so the lymphatic capillaries doesn't know that lymphatic fluids contains bacteria, virus, or waste products. The lymph node is the only important organ for fight against bacteria. So there are lymph nodes. Lymph nodes will be there for try to fight against bacteria or try to kill the bacteria or virus in that lymphatic fluid. And then the waste products are flushed out from the body, and the clear fluid is that drained into the bloodstream. So this is how our lymphatic system works. I hope you all understand about the lymphatic system now. So now we are moving on to the lymphedema part. So lymphedema is a pathological accumulation of lymphatic protein rich lymphatic fluid into the interstitial tissue spaces due to an imbalance between the interstitial fluid production and transport. So there is an imbalance between the production and transport. Okay, so the production will be there all the time, because wherever the arterial capillaries and the venous capillaries are communicating together, the lymphatic fluid will be originated. So the production will be there all the time, but the transportation will be difficult, because if a person diagnosed with carcinoma breast, we need to remove the breast and also adjacent lymph nodes too. So when we remove the adjacent lymph nodes, the transportation is stopped there. Okay, the production will be there, the transportation will be difficult, because of that there is an accumulation of protein-rich lymphatic fluid in the interstitial tissue space that leads to edema. So this is called lymphedema. Clear? So coming to the classification, according to the International Society of Lymphology, it has been classified into two, primary and secondary. Primary is congenital lymphatic dysplasia. From the birth itself, there is a malformation of that lymphatic system. So there is a congenital anomaly. So secondary is anatomical obliteration of the lymphatic system. So now our anatomy is okay, but tomorrow if there is any happening in our anatomy, if there is anything happening in our system, so our anatomy is changed, right? Little bit changes happen. So sometimes if that is happening in our lymphatic system, so that we can also develop lymphedema. So secondary again divided into two, non-malignant and malignant. So from this slide, you have to understand that non-malignant persons can also develop lymphedema. Okay, so for example, major road traffic accident. So if a person's that met with a road traffic accident, major road traffic accidents, it maybe sometimes inguinal lymph node will get affected. So that person's immediately it does not happen anything, but maybe later stage, gradually that persons can develop lymphedema. And burns, infections, recurrent infections, for example, cellulitis, hydrogenic surgery and radiotherapy. So these all persons, the kind of patients can develop lymphedema. Coming to the malignant, primary lymphomas and the secondary recurrence. So this is the classification of non-malignant, secondary lymphedema. So this is a case scenario. Miss ES, 50-year, was diagnosed with the carcinoma breast left with lymph node metastasis about 1.5 years ago. She underwent modified radical mastectomy with axillary dissection, followed by chemotherapy and radiation. She has been noticing that her left upper limb is progressively getting swollen for the past 3 months. She feels it heavy and experiences pin and needle sensation along the whole limb. So what is your probable diagnosis here? Can anyone say? Anybody? So either unmute yourself and talk, or you can put your answers in the chat box. Anybody?
Ma'am, there is a command non-malignant.
So non-malignant. Okay. Anamika, why you are saying non-malignant?
Ma'am, I think like because of like trauma, she she had this like
This
cancerous.
patient is diagnosed with the carcinoma breast, right? With the lymph node
Yes, ma'am.
metastasis about 1.5 years ago. She underwent modified radical mastectomy. Okay, so the radical
Yes,
mastectomy
ma'am.
is with the axillary dissection is also done, followed by chemotherapy and radiation. Now she is reporting, she is sitting in front of you, and her main complaints is so she noticing her left upper limb is progressively getting swollen. So she is complaining of edema for the past 3 months. She feels it heavy and experiences pin and needle sensation along the whole limb. So what do you think?
I think maybe due to infection.
Okay.
Mm.
Why she develop edema? So, thank you, Anamika, for your answer. So here, this patient is having lymphedema because I already said, if a person diagnosed with that breast cancers. So we usually done that mastectomy, right? So here also modified radical mastectomy with axillary dissection is done. So when if we done an axillary dissection, there is no lymph node is there for the transportation, that transport that lymphatic fluid from that affected area. So that accumulation of protein-rich lymphatic fluid into that area. So that leads to swelling. So maybe because of that she developed swelling. And when the edema develops, so our skin will stretch maximum. Okay, so when fluid is accumulated, our skin will stretch maximum, but after a period of time, so she may feel pain because of the fluid overload. Heaviness will be there. Heaviness will be. She is not able to maybe that do anything because of the heaviness. Numbness will be there, and also feels pin and needle like sensation will be there. So this probable diagnosis is lymphedema. So coming to the diagnosis. So now we all know that, we all nurses, we know there are other conditions can also develop edema. For example, renal failure patients, cardiac failure patients, respiratory failure patients can get edema, especially cardiac failure patients and renal failure patients can get lower leg edema. So no, not all edema is lymphedema. From you have to take a proper history. From the history itself, you will understand that what kind of edema it is. So you have to ask them what are things you have to ask them, whether there is an unknown cause. So because she is reporting, she is sitting in front of you complaining of edema, right? So you have, it's our duty to take a proper history, whether there is any unknown cause, whether there is any disease related or trauma related, whether there is any treatment related. Okay, so now if you take a proper history, definitely you will understand everything, and based on your that history you will plan, right? So based on your assessment you will plan. So if you do the proper assessment, you will make a good plan. So if you make a good plan, so that will help to the patient, right? So we are trying to control their symptoms. We are trying to improve the quality of life of the patient and their family. So here also the assessment is very, very important. Okay. So after that, you have to do the clinical examination. So according to the International Society of Lymphology, that stages is classified into four. Start with 0 and end up with the 3. Stage 0 is a subclinical state where swelling is not evident. Okay, so now we have seen a patient. So just imagine that patient is not having any edema, but that patient is going to develop edema because we already that remove the axillary lymph node. So that patient is maybe later stage that patients will develop edema. When you see that patients, there is no edema. Okay, but already the diagnosis was carcinoma breast with that mastectomy done. So stage 0 is a subclinical state where swelling is not evident. Okay. And the stage 1 is pitting edema stage. So look like a orange peel skin. It look like it looked like a orange peel skin. You can see this picture. You can apply your finger pressure on this area. You can able to see your finger point. So this is stage 1. So coming to the stage 2, so the tissues have become fibrotic and hardened. So if you are not giving attention into the stage 1 period, that goes to second stage. So that time you will not be, the tissues not soft. So in the pitting edema stage, you can able to that feel that soft skin. So, coming to the third stage, the tissues are considerably hard and cartilage formation will be there. Sometimes creases formation will be there. You can see this picture. So, if there is an creases formation there, so there is a chance of dirt accumulated in between the creases, and then that leads to fungal infection. So, when we do the assessment, you have to do the proper assessment and you have to give up special attention to these areas. So next is about stemmer sign. The stemmer sign, which this is only one sign which we have seen in lymphedema patients. You can see your that you can check your skin also. You can check your upper limbs. So you usually we can able to lift up our upper part, that middle finger of that proximal phalanx. Okay, but for a lymphedema patients you can't. So inability to pick up the fold of a skin over the proximal phalanx of the second or middle finger. That is the positive sign of lymphedema, because here so we usually use this stemmer's sign, but if you look in the Western countries, they usually, when they document it, is an lymphedema present and the stemmer sign is positive. So that is how they document it. So stemmer sign is very, very important. You have to understand that stemmer sign is positive if the patient is having lymphedema. Okay. So inability to pick up the fold of the skin over the proximal phalanx of the second or a middle finger. You can see this picture. Okay. So coming to the diagnosis, so other diagnostic methodologies are soft tissue imaging. And lymph vessel imaging and bioimpedance spectroscopy. These all will help us to determine the extra volume, detect the abnormalities, and also we can able to measure the interstitial fluid volume. So for a palliative care patients, we don't recommend these kind of expensive investigation procedures, because from the history itself, we can understand that what kind of edema it is. But in case of primary lymphedema, we have to find out the the extra volume and whether there is any treatable underlying cause. So we have to understand the interstitial fluid volume measurement. So these all things is very, very important in the primary stage of lymphedema. Okay, primary classification of lymphedema. If there is any correctable underlying cause there, we have to correct it. But for a palliative care patients, from the history itself, we can understand that what kind of edema it is. Coming to the problems. So pain and discomfort will be there because our skin will stretch maximum. Pain and discomfort will be there. After that, the patients may feel pain and discomfort. Tightness will be there. Heaviness will be there. They will not be able to lift up their affected limb because of the heaviness. Fatigue will be there. Numbness, impaired mobility. They will not be moved their lymph independently because of the fluid volume, loss of functions. So it will be affecting the daily activities also. Sometimes they will not be able to continue the they will not be continue the daily activities, and also they will not be do the self-care. So that will be affecting the patient emotionally. Coming to the psychosocial problems, body image. So the body image is one of the most important part here, because I have seen many patients when they come to the hospital, they usually cover the affected limb with their own dupatta, because nobody is willing to expose their affected area to the public. Okay, when they expose that affected area to the public, what happened? So the people are asking many questions. They need to they need to answer many questions, right? So because of that, they will usually cover the affected limb. And also if so that also is affecting the emotionally. So because of my disease, because of my this problem, I won't be able to expose my limb. So that will be affecting them emotionally. Loss of independence. Maybe if they want to take anything from the cupboard, they need to depend others. And if they want to take any, maybe they sometimes they will not be able to that maybe do household activities because of the heaviness and because of the edema, loss of change of employment. They will not be able to continue the same job after this problem. Difficulty in wearing clothes and shoes. They will not be able to wear clothes and shoes, and anxious and anxiety and depression, because so we know this is because of the mastectomy, right? This is because of mastectomy that this patient has developed edema, but the patient doesn't know where is the fluid is originated. The patient might be thinking like, okay, so this is also is a part of my disease. Maybe my disease is spreading to my hand also. So this is how they might be thinking. Okay, do one thing. So whenever you have seen these kind of patients, sit down and talk and explore their emotions, what they are understanding about this edema, and make them understand that what is edema, what is lymphedema, and so that they will maybe the anxiety can reduce. If you are not giving adequate attention into the anxious anxiety period, so the patients might go to depression. Okay, and the next problem is social isolation. So coming to the social society, maybe relatives, neighbors, friends may not be willing to see these kind of patients, maybe because of misconception of disease spread, maybe disease spreading. So sometimes other problems will be there. So maybe this if and if the person is not if a friend or neighbor is not going to not coming as maybe previously because of these conditions, so it will be affecting them emotionally. Because of my disease, my relatives, my friends and neighbors are not willing to my house and see me. So and next is constant reminder of disease. So again, maybe they might be thinking like, okay, my disease is spreading to my hand also. This is if there is a edema there, they always remember their recollecting and remember their that illness. Okay, so that is also affecting the patient emotionally. Coming to the management, there are four principles of management of lymphedema. One is skin care, second one is massage, and third one is compression bandaging, fourth one is exercise. So these are the four principles of management of lymphedema. And the one more management is there, intermittent pneumatic compression pump. So I'll take that part later. Let's see one by one. So before moving on to the management part, we have to do the measurement. So we know there are four principles, but before moving on to the principles part, you have to do the proper measurement. So in the initial period, in the first time, you have to take both limbs, affected and non-affected limb. So you give a comfortable position to the patient and give a comfortable. So we are going to take a measurement. For the upper that part, upper limbs, from head of the ulna plus 2 centimeter, then every 4 centimeter. First, you have to mark like this, and then you have to take a measurement, circumference. And then for the lower limbs, from the ankle joint plus 2 centimeter, then every 4 centimeter. First, you have to mark it, and then you have to do the take measurement with the help of a measuring tape. Circumference, you have to take a circumference and note it in the lymphedema chart. Coming to the skincare, always so remember this area is prone to develop infection. So that part is very, very important. Whenever you have seen these kind of patients, you have to teach about, you have to give a proper education about skincare. Okay, so apply simple moisturizing cream just after bathing, because after bathing they can do apply some simple moisturizing agent if there is a dry skin there. And meticulous drying between the digits. In between the digits, there is a, because of the edema, if there is an edema there, there is a chance of dirt accumulated in between the digits. So that leads to, if you are not giving special attention to that area, so the fungal infection will be there. Okay, so we need to give a special attention to that part. avoid injections, venipuncture, avoid RSS. So if you do injections, venipuncture, RSS into that area, what happen? Sometimes if you sometimes it will not happen anything, but sometimes it may, if there is any maybe that aseptic technique is not followed while be giving injections, so there is a that chance of chance of that microorganisms entry, right? So that means that leads to cellulitis. Okay, so always avoid these kind of areas for giving injections and venipuncture. So we need to prevent infections. We need to protect the patient. So whenever, so we usually that giving instruction to the patients whenever they go to the hospital, they have to tell the nurses, I'm having that maybe this that hand is not good for injection. So I have done my mastectomy, these kind of, but because the nurse doesn't know that that patient is done with any mastectomy or not. So you have to tell them. And avoid blood pressure cuff. It will be affecting the collaterals, and avoid injury and injury. So most of the women, they are working in the kitchen because they are working in the kitchen. So it cut can happen. Okay. So if there is any accidental cut happen, what they have to do? So they have to keep that area clean and dry. So and check for infections also. If there is any signs and symptoms of infection, they have to clean. They have to take antibiotics for that. Okay, so that is the management for that. So that is very, very important. You have to tell them, keep that area clean and dry. If there is any signs and symptoms of infection, they have to take antibiotics for that. And avoid carrying heavy things, because if they take heavy things, what happen? The blood circulation will increase. That leads to production will increase. So ask them to take less weight, simple weights. Coming to the massage, there are two different types of massage, manual lymphatic drainage and the simple lymphatic drainage. So the manual lymphatic drainage is done by the trained professionals, and the simple lymphatic drainage is done by the patient with the help of a caregiver or a volunteer. So how can we do the massage? So the difference between the manual lymphatic drainage and the simple lymphatic drainage is, so the simple lymphatic drainage is done by the patient, right? So the patient doesn't know how much pressure is needed for moving the fluid from one area to the next area. So we don't encourage the patient to give massage to that affected area. Okay, so that is the one difference between the manual lymphatic drainage and the simple lymphatic drainage. All other things they can do, they can they can apply bandages, they can stimulate superficial lymph node, they can take a deep breathing exercise, they can do exercise, but they should not touch the affected area. That is the major difference between the manual lymphatic drainage and the simple lymphatic drainage. So if you have a trained professional there, so if you have a trained professional there, then you can do the manual lymphatic drainage. Then you can do the manual lymphatic drainage. So if we are trained professional there, we know how much pressure is needed for that. So we can do the massage for the affected leg. So how can we do it? You have to always tell the patient to start with a deep breathing exercise. So deep breathing exercise is one of the most important part here, because we have around 600 to 700 lymph nodes in our body. If you take a deep breathing exercise, so all the internal lymph nodes will get stimulated. So they are ready for collecting the fluid, because we are going to push the fluid from the edematous area to the non-edematous area. So here what you have to understand is you have to giving proper instruction to the patients, because that deep breathing exercise is very, very important here. And the next step is stimulate the superficial lymph node. You can see this picture. There are many lymph nodes in our superficial that neck region. Okay, that is also superficial also. We can stimulate the superficial lymph nodes and stimulate the opposite side of affected axilla or groin. Then after that, you can massage the proximal area. Once you clear the proximal area, then go to the distal area. So use gentle pressure. This is how we do the lymphatic drainage, manual lymphatic drainage. So these are the contraindications of the manual lymphatic drainage: acute cellulitis, renal failure, unstable hypertension, severe cardiac insufficiency, ascites, superior vena cava obstruction. So if there is acute cellulitis there, give an antibiotics for that and try to control the infections. Renal failure and unstable hypertension, severe cardiac insufficiency there. So the problem is that leads to fluid overload, and then again the patients might have developed breathlessness. So these conditions, better you don't do active management. And also superior vena cava obstruction also, that patients can develop breathlessness. So if they don't have these kind of issues, you can do the lymphedema massage. So I'm going to show a video on manual lymphatic drainage.
Is there any problem? Shiba ma'am?
Part 1. Manual lymphatic drainage or massage. Gemma is suffering from breast cancer and has developed lymphedema on her right arm. She has been admitted to the hospital for the management of lymphedema. Lymphedema is a condition in which excess fluid called lymph collects in tissues of the body and causes swelling. 4 common steps of management of lymphedema are manual lymphatic drainage or massage, compression bandaging or hosiery, exercises, and skin care. Sister Sandhya is going to perform manual lymphatic drainage procedure on Rema. This is done by trained professionals only. This will be followed by compression bandaging of the arm and educating Rema on exercises and skin care. Manual lymphatic drainage. Manual lymphatic drainage is a light skin stretching technique to stimulate the lymphatic system. This massage helps to move fluid away from areas of the body that may be swollen by lymphedema to the areas with normal lymphatic flow. Before starting the massage, it is important to measure and record the girth of the affected and unaffected arm. This will help to assess the effectiveness of the measures taken for lymphedema management. Articles required: 1 measuring tape, 1 marker pen, 1 pair clean gloves, lymphedema chart. Procedure: greet the patient and caregiver. Explain procedure to the patient and caregiver and take consent. Provide privacy. Wash hands and wear clean gloves. Provide a comfortable position to the patient. Place the affected arm supported by a pillow over a table. First, measure the girth of the affected arm. The first measurement should be from the head of the ulna plus 2 cm and then at every 4 cm intervals up to the shoulder joint. Mark the points with a marker pen and then measure the girth. Document the measurement properly in a lymphedema chart. Repeat the same procedure on the unaffected arm and document. Instructions for doing massage. Use gentle pressure to stretch the skin as far as it naturally goes and then release the pressure to let the skin come back as it was. Use the flat of the hands instead of fingertips. This will allow more contact with the skin to stimulate the lymph vessels. Do not massage if there is pain or redness on the arm. Procedure. Start with deep abdominal breathing. This helps to stimulate the lymphatic system in the whole body. Ask the patient to place the palms of hands on the stomach and then to slowly breathe in deeply through the nose and breathe out slowly through the mouth, pursing the lips. The abdomen should rise with the intake of breath. The abdomen should fall back and flatten on breathing out. Repeat 5 to 10 times. Ask the patient to take a short rest between each breath. Now stimulate the neck nodes. Massage the front of neck. Stimulate the supraclavicular nodes above the collarbone on both sides of the front of the neck by stretching and releasing the skin in a J-shaped manner as shown. Repeat 5 to 10 times. Massage sides of the neck. Stretch the skin on the sides of the neck away from the face and release. This is to stimulate the neck nodes. Repeat 5 to 10 times. Massage the back of the neck. Stretch the skin downwards on the back of the neck on both sides and release. Repeat 5 to 10 times. Massage the unaffected axilla. This is to stimulate the axillary nodes. Place the palm against the unaffected axilla. Gently pull up the skin and in towards the body, then release. Repeat 5 to 10 times. Massage the upper chest. Stretch and release the skin from upper chest to neck on the affected area. This step will move fluid up to the neck nodes. Repeat 5 to 10 times. Prepare the chest. Stretch the skin over the chest and release in small strokes. Start close to the affected axilla and massage across the chest over to the unaffected axilla. This will help the fluid to move away from the affected axilla to the lymph nodes, the unaffected axilla. It will also prepare the chest to receive more fluid from the affected arm. Repeat 5 to 10 times. Prepare groin area. This stimulates the healthy inguinal nodes on the affected side. Stretch the skin upwards towards the umbilicus and release. Repeat 5 to 10 times. Prepare the trunk. Gently stretch and release the skin from the chest on the affected side down the side of the body to the groin area. Repeat 5 to 10 times. Then stretch and release the skin from under the affected axilla down to the groin. We shall now start the massage of the affected arm. Massage the upper arm. Start at the shoulder and gently stretch and release the skin, moving over shoulder towards the neck and across the chest towards the opposite axilla. Repeat 5 to 10 times. Then stretch and release the skin from the inside and outside of arm to the top of upper arm and up the shoulder. Repeat the shoulder step to finish. Repeat 5 to 10 times. Massage the forearm. Stretch and release the skin from inside the forearm to the back of the arm and release. Then stretch and release the skin on the outer side of the forearm to the upper arm. Repeat the shoulder step to finish. Repeat 5 to 10 times. Massage of swollen hand. Gently stretch the skin on the back of the hand towards the forearm and release. Repeat 5 to 10 times. Massage the swollen fingers. Place your index finger and thumb on the swollen fingers. Gently stretch and release the skin towards the palm and massage the entire finger. Repeat 5 to 10 times. Then do the entire sequence of pushing the fluid up to the arm and shoulder, across the chest to the healthy axilla, then down the chest towards the groin about 5 to 10 times. Repeat deep abdominal breathing. Finish the massage by asking the patient to repeat the deep abdominal breathing 5 to 10 times. This finishes the procedure for manual lymphatic drainage. This is followed by compression bandaging, which will be shown in the management of lymphedema of arm part.
Hope this video is clear to everyone. Any doubts? So after the massaging, we usually give bandaging. We used to give bandaging with that crab. We used to use crab bandages for bandaging. So here, what you have to understand is you have to that keep that area that very clean and dry, and also we have to protect the area, the skin from infections. So few of our patients develop infections when they apply crepe bandage directly to that affected area. So before that put before you put the crepe bandages to that affected area, better to protect the affected area with a that thin cotton layer, so that area you can that maybe protect from allergies. So you can see this picture. You can the wrap with a small thin cotton layer first, and then you can put a bandage. So then we usually start with a crepe that 50 percentage overlap, that is spiral bandaging, and we will teach the caregivers, so the caregivers will be able to do the bandagings when they are in the home. So then do one thing, you have to send the patient back to their home, ask them to come back after 2 weeks, 1 week or 2 weeks if they are. So when they come back, you have to do the proper assessment whether you can ask them whether they are able to tolerate these bandages or not. Then if they are able to tolerate the bandage, then you have to move on to the figure of eight bandage, that is multi-layer bandage. So if you do multi-layer bandage initially, they will not be able to tolerate. So they will not continue, they will not come for follow-up also. So you're better to give a spiral banding, that is 50% overlap first, and then try to get feedback from the patients from the follow-up time. So then if they are able to maintain the spiral bandage, then you have to go to the figure of eight bandages. So that all give more pressure, and will help to move the fluid from one area to the next area. For the lower limbs also same thing. So when we do bandaging, you have to make sure that there is the nail is that exposed, because if there is any obstruction there, we can identify it is easily from the nail bed. So bluish discoloration will be there, and another part is that in the crepe bandage that bandage bottle itself, there will be a clip. Okay, metal clip is attached for that, for the fixing of the bandages. So for the lymphedema bandaging, you should not use that clip for fixing the bandages, because that clip has a sharp edge. So that might be maybe give a small break into the skin, and that leads to cellulitis. So better to so always use a micropore for fixing the bandages. And then one more video I have, I'm going to show you to later. So then the fourth management is exercise and elevation. Teach the patient for a simple exercise So for the preventive post-operative period itself, we used to teach the patient for prevention of pressure, prevention of lymphedema. Give just a small exercise they can do. But and also if we when the patient come with edema, also we have to teach some exercise. So after bandaging, they have to do one exercise for their hands. You have to give a physiotherapy ball to the finger and ask them to squeeze out so that the fluid will move up, and one for wrist and one for elbow and one for shoulder, so that our aim is to push the fluid from the edematous area to the non-edematous area. So after these exercises, encourage them to take again deep breathing exercise and elevate the limb for at least half an hour, so that all that accumulated fluid will drain up. So this is the another management way, intermittent pneumatic compression pump. I already explained. I already highlight this point before. So this is how the intermittent pneumatic compression pump is there. So you can able to insert your affected limb into that area, so that you can see this picture. You can able to put your affected limb in your this garment. We can able to adjust this pressure. So based on the pressure and duration, we can this machine is functioning, so that give like a blood pressure cuff. So give a small pressure and releasing the pressure, and give again small pressure and again releasing. So our idea behind this pump is pushing the fluid from the edematous area to the non-edematous area. Okay. So there are two complications of lymphedema. One is cellulitis and the another one is lymphoria. So cellulitis means infections, acute inflammatory episode. Okay. So we know what are the signs and symptoms of cellulitis. There will be the redness, tenderness, pain, swelling. So these all things will be there. So if you notice these kind of changes in that affected into the lymphedema site, treat with an antibiotic. So the antibiotics is the first line management of cellulitis. Once the edema comes down, then you have to go for an active management. Okay, so this is how the cellulitis management. So the active management of lymphedema is not permissible. So here is contraindicated. So once the cellulitis comes down, then you move on to the lymphedema management part. So the second that complication of lymphedema is lymphoria. So lymphoria is leaking out of fluid from the lymphedema site. That from the lymphedema site there will be a leakage. Okay, so do one thing. You can you have to cover this area with a dressing pad, and then you can do the crepe bandaging. So here no contraindication. You can do crepe bandages, or you can apply crepe bandages, so that all extra fluid will come out. So here you can do bandages. So thank you. So I have one more video. Let me show that, and after that I am happy to take questions.
Dear participants, if you have any, sorry.
Lymphedema of the arm. Part 2. Compression bandaging. Compression bandaging is layered bandaging of the affected limb to control swelling. It should be taught to the caregivers so that it can be done daily at home. Articles required. Thin layered cotton roll covered with gauze piece 1 3 cm crepe bandage, 1 6 cm crepe bandage, 2 8 cm crepe bandage, 1 pair of clean gloves, 2 dressing pads, 1 adhesive tape. Procedure. Start with cotton padding wrap. Make a small hole at one end in the cotton padding. Start wrapping around the thumb of the affected arm from the wrist in a spiral pattern till the shoulder joint as shown. Fix the end of the bandage with adhesive plaster. Wrap the fingers with 3 cm crepe bandage. Start wrapping the bandage slowly around the wrist and then wrap the thumb first. Bring the bandage up towards the bottom of the thumbnail. Start wrapping from the bottom of the thumbnail around the thumb 3 times towards the base of the thumb. Wrap the bandage around the wrist again. Continue wrapping each finger the same way, ending with wrapping around the wrist. Keep the nails free. Fix the end of the bandage with adhesive plaster. Do not use metal clips to fix. Then spiral wrap forearm with crepe bandage. Begin with 6 cm bandage. Wrap around the wrist once without pulling. This will secure the bandage. Now continue wrapping the same bandage up the arm in a spiral manner. Overlap the bandage by half with each wrap. Always give a gentle pull on the bandage at each half turn to keep an even pressure. Continue the same way till you reach the elbow. Fix the end of the bandage to stop it from getting loose. Place an extra cotton pad on the hollow of the elbow to ensure evenness of the surface. Now take the 8 cm bandage. Wrap the bandage over the elbow in the figure of 8 with elbow bent slightly. Continue wrapping in a spiral manner all the way up to the top of the arm. Fix the end of the bandage with adhesive plaster. Examine nails for any bluish discoloration after the procedure. Support the bandaged limb with a pillow. Ensure the patient is comfortable without any pain or discomfort in the arm. This completes the procedure for compression bandaging. Review the patient after 1 week. Measurement of the arms should be taken and compared with previous recordings. If the patient can tolerate the spiral bandaging, figure of 8 bandaging for the arm can be given. For this, the finger bandaging remains the same. Figure of 8 bandaging increases the number of layers of bandage applied and results in higher sub-bandage pressures than spiral bandaging. This procedure should also be taught to the caregivers. Exercises. Along with compression, special exercises will help to pump lymph out of the swollen area. Exercises are done at the level of fingers, wrist, elbow, and shoulder. Deep abdominal breathing should always be done at the beginning of the exercises at least 5 to 10 times. Shrug the shoulders and bring it down 10 times. Lift the arm up above shoulders and bring it down. Do it 10 times. Bend the elbow and try to touch the nose. Then straighten the elbow. Repeat this 10 times. Move the wrist in a rotatory fashion and up and down. Repeat this 10 times. For fingers, squeeze a physiotherapy ball. Do it 10 times. Deep abdominal breathing should always be done at the end of the exercises at least 5 to 10 times. Skin care. Educate patient on the methods for skin care of the affected arm to prevent infections. Always keep the affected arm clean and dry. Wash the affected arm with unperfumed soap and water regularly. Pay special attention to the spaces between the fingers and the creases. Apply white petroleum jelly while the skin is wet. This is to keep the skin lubricated and supple. Pat dry the skin and the spaces between fingers with a soft, clean towel. Do not rub the skin with the towel. Avoid tight clothing or jewelry on the affected arm. Avoid needle pricks on the affected arm, either for IV fluids or for checking blood sugar or drawing a blood sample. Do not use the arm for recording blood pressure. Do not scratch the arm with your fingernails. This will lead to trauma and infection. Do not lift heavy weights with the affected arm. Do not apply heat on the affected arm.
Thank you. Any doubts?
Okay, participants, kindly ask your doubts. Stanzen. Or else you can call someone's name. Otherwise, they won't respond.
Anybody? Do we have a case presentation? No.
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 So, is there any doubt, Mr. Kanagaraj?
So if they don't have any doubts, we can wind up.
Sure.
Thank you.
So, thank you, ma'am. Thank you for your insightful session, and thank you participate in the session. So we can wind up for today.
Thank you.
Thank you, ma'am.